So we have the factory.
That's insane. So essentially the H. pylori goes and sneaks into the factory, disables the acid controls, which helps bore the stomach lining and neutralizes the acid.
To the next part of the body in an appropriate manner.
Interesting. So that would make sense on why some stomach acid, and what it actually does, it breaks down the protein, the usable amino acids, just enough so you're able to absorb some of that. Due to the pressure, it can lead to other problems involved, GERD, acid reflux, stuff like that. In terms of today, the acidity is going to be a big part of what we're talking about, but also how it helps filter and process that digestion.
Tank is what mixes the acid. That would be the muscular contractions, also known as peristalsis. Churns everything into the liquid called chyme. Welcome back, everyone, to the Functional Code. We're excited to bring you guys today another episode. Today we are talking about the stomach in our organ series. We're going to be talking all about how acid is made, why acid is important in the stomach, actually the ins and outs of stomach health, things around it, what people are doing, treatments for it as far as weight loss, as far as other things like that. Look forward to stay tuned and learn all about that. As always, I am Dr. Addy.
And I am Dr. Jace. Yeah, there's a lot of stuff that we're going to get into that you may have never thought about in terms of natural ways for treating or the healing process of the stomach. If you had maybe a gastric bypass or gastric sleeves, and like what that is and what that looks like into the system. So essentially we're going to get into all things stomach today and how your body processes food. Now, a lot of people don't realize that, fascinating enough, the stomach produces 1.5 liters of gastric acid a day, and the stomach acid is a pH from 1.5 to 3.5, which is roughly about the same acidity level as a battery acid, which is insane to think of. I know we brought this up in last episode on terms of the esophagus and the sphincter and how pretty much the acid gets brought back up due to the pressure. It can lead to other problems involved, GERD, acid reflux, stuff like that. In terms of today, the acidity is going to be a big part of what we're talking about, but also how it helps filter and process and that digestion of all the foods that you consume overall. The other part I do want to dive into as well is H. pylori is also, it's pretty much a bacteria that causes most ulcers, and it affects about 44% of the global population, which is a lot of people.
That's a lot more than I thought.
Yeah, way more than I would have thought too. Let's go into just the chemical factory, what it looks like, the jobs of the stomach, and let's dive into that a little bit.
Absolutely. So we have the factory, okay? The acid bath, hydrochloric acid, breaks proteins down. It can even kill pathogens, which is why we state the stomach is a huge part of the immune system, is because that is a huge way for us to improve pathogenic eradication. And it creates the environment for every downstream process depending on that. So the mixing tank is what mixes the acid. That would be the muscular contractions, also known as peristalsis. Churns everything into the liquid called chyme. It leaves nothing until the factory approves it. Now the security team, that's the acid pH that kills most of the bacteria and the viruses before they ever get into the small intestine. So you also not only want to make sure you have enough acid, that's one thing. You want to make sure that we have enough peristalsis for it to move around, and then finally you want to make sure that the actual pH is correct. This is how we kill all the pathogens, we break down the foods we need to, and it moves through to the next part of the body in an appropriate manner.
Interesting. So that would make sense on why some stomach acid, and what it actually does, it breaks down the protein, the usable amino acids, just enough so you're able to absorb some of that stuff. And even with some of the triggers of essentially needing, and your B12 absorption is pretty much needed in this process, because with no acid equals the B12 deficiency, especially over a period of time. So you want to create the proper environment for iron and calcium to absorb. Low acid also causes poor mineral uptake, which I did not know that, or put the pieces together. So essentially, if you have poor or lower acid, you also want to make sure your minerals, you're getting a proper amount of electrolytes and all
Yep.
that stuff into your system as
Yep.
well.
And then it activates pepsin, which can help with protein digestion. And it also signals the pancreas and the gallbladder that food is coming. Get ready for that process to get started.
Okay, so we have our team. We have the ice bath, we have the mixing tank, and then the security team. So let's go into the pyloric valve and how it goes pretty much from the stomach, pyloric sphincter, and then helps for the gate going into the small intestine. And we want to make sure that pH is correct in that transition so the body can still help absorb and also process foods as we go and moving forward as well.
Yes, now the factory gets sabotaged. So let's go back to H. pylori for a second. So when H. pylori sneaks in, and to be honest, a lot of the ways that it can happen is due to decreased acid production, or we are taking something that is trying to reduce the amount of acid that's being created because we have reflux, we have issues. The reason why there are a lot of patients who develop like C. diff, bacterial reaction from taking too many PPIs, is because it does decrease the amount of acid production and thus not allowing the correct pathogens being killed while we're consuming food, and thus creating that environment later on. One of the most common ways that patients develop ulcers, can also develop more H. pylori infections, is chronic NSAID use. And most patients don't understand that on the back of your NSAID bottle, if you turn it around, it says do not use for longer than 10 days. Most patients are using NSAIDs every single day for how many years, Doc?
It's quite a while.
Yeah.
Yeah.
And we get very concerned because these can damage the stomach lining. It can increase gastritis, it can increase ulcer risk, and if it goes untreated, it can increase stomach cancer risk.
Wow.
When we have a bacterial overgrowth of H. pylori. So that is one of the ways that the factory, we'll call it, can get sabotaged, and it can cause a whole host of other issues if it goes untreated. And like we said, it may not seem like a big issue, but 44% of people have this globally, and some have no symptoms for years.
That's insane. So essentially the H. pylori goes and sneaks into the factory, disables the acid controls, and then which helps bore the stomach lining. It neutralizes the acid called urinase, and it helps set up this protective colony. The factory keeps trying to produce that acid, but the saboteur of H. pylori essentially keeps blocking it.
Yes.
Now, the next fail mode that the stomach can have is the factory runs cold.
Yes, so hypochlorhydria, too little acid, which is similar to what we spoke about when we're on a lot of proton pump inhibitors. There are other things that can decrease stomach acid production, but we'll call it when the factory runs cold, production drops. So now the protein line slows, minerals don't get properly extracted, security checkpoint weakens, food backs up, pathogens form. A lot of other things can happen when we have too low of stomach acid.
So there's that bloating that you get,
Yep.
especially after high protein heavy meals.
Yep.
Undigested food, so the stool just comes out. Essentially, chronic B12 iron deficiency is common in this. Burping after meals,
Yep.
which makes sense. Okay.
Stress, H. pylori history, long-term PPI use, autoimmune issues can be risk factors for low stomach acid. But it's one that gets misdiagnosed as acid reflux, and it's treated with more acid suppression. But like we've spoken in the last episode, GERD, acid reflux, is more of a pressure issue than an acid issue. Not to say that we don't see certain changes in certain populations with lower acid, but for a lot of GERD patients, they have normal stomach acid. It's that the central adiposity, the obesity is creating way too much pressure, belly pressure, forcing acid up, weakening the lower esophageal sphincter, causing more of an issue, can create hiatal hernia, making it weaker around that sphincter as well, just creates a whole host of other issues. So this is actually when we do have low stomach acid, what that looks like.
And then the last thing that it can fail with the stomach is the factory floor is inflamed. And this is where causes can come from H. pylori, NSAIDs, which we brought up, ibuprofen, aspirin, excessive alcohol use, chronic stress. Just pretty much the burning pain can get worse on an empty stomach. That's a classic sign. Usually gastric ulcer is the pattern from there. So when you're having gastritis, the factory floor itself gets damaged.
Yep.
The protective mucus lining that keeps acid from touching the stomach wall erodes. Now the acid is eating the wrong thing, essentially.
Yes. It's very painful. You can delineate between different ulcers by how food changes it. If food tends to make it worse, it's more commonly a gastric ulcer, versus if food tends to make it better, it's more a duodenal ulcer. I do remember that.
Yeah.
However, I'm sure there are variations of it. It's not always textbook with patients, but if you do feel like you have been chronically stressed and you are maybe taking a lot of NSAIDs for pain, and you end up getting extremely bad stomach pain, burning sensation, please go get this looked, because ulcers that do not get treated can end up perforating and cause you even more issues down the road.
Yeah,
and so we want to make sure that you take the right time to heal the lining, obviously get off the NSAIDs, and make sure that you're going to treat the H. pylori with appropriate medication.
Absolutely.
Yep.
So recap, the factory gets sabotaged, the factory runs cold, or the factory floor is inflamed. Now, taking that into foundational toolkit on what and the reasons why certain things will help. A big one is meal spacing. Every 3 to 4 hours, spacing them out between meals is incredibly important. Especially the stomach needs time to fully empty between meals before the next load arrives. It allows the acidity to get back on the same page. It allows pretty much the whole fermentation and bloating, the pressure to re-regulate itself. There are certain things known as like migrating motor complex, or your MMC, which the stomach itself is a cleaning cycle, but only runs in a fasted state. So essentially this migrating motor complex needs an empty stomach in order for it to re-regulate itself.
I do feel that, and this was similar to when I was having issues with my stomach, but intermittent fasting helped a lot with my stomach pain. And I do feel like it is because it shortened the window for digestion to happen and allowed for almost recovery of the stomach.
Yes.
If we're thinking of in terms of like recovery as a muscle, as a system. And most patients, when they do have stomach issues, and we'll use that as a broad stomach issues because there's a lot of things that can cause stomach pain, stomach issues, but meal timing does seem to help with a lot of the broad stomach issues people have. And if you're over consuming foods, you more than likely are just making it harder for the stomach to recover and repair if you do already have issues with acid production, with breakdown, with things like that.
Yeah. So key rule of thumb, 3 to 4 hours in between active eating cycles. But yeah, give that one a go. Now, Doc, the next one, temperature and timing. Warming first. I'm interested on that one.
I would say the most talked about way of improving even consumption of meals or bloating, stomach pains, is choosing not to drink a liquid with your meals, because it can dilute the stomach acid if you're drinking water. And there are just the feeling of fullness that extra liquid adds when you already have maybe stomach pain, bloating, or pressure. So they do recommend that if you are going to consume liquid, you do a herbal tea or warm water before you eat, which can help prime the stomach. We'll get into other things that can prime the stomach in just a second, but this is more of a Ayurvedic Chinese traditional medicine than maybe the physiology obviously supports it. But believe it or not, these traditions have been around for thousands of years.
Yes.
I would say that whether or not the research supports it, there are patients who I've talked to that have tried so many things for their stomach, And you'd be surprised at what finally sticks and what finally helps with a lot of the things that people are trying. And why I think that matters is because not one thing doesn't fix the next person's thing. So yes, research is probably really spotty around a lot of this stuff because it doesn't help everyone with every little thing. But you'd be surprised at people having a lot of issues telling me that they tried this one thing and it really helped them out. Perfect. As long as it's not something that's going to cause crazy side effects. Yeah, drinking an herbal tea 30 minutes before digestion, give it a try. It doesn't hurt anything.
Yeah, it stands the test of time,
For sure.
essentially. And anything that stands the test of time, there's something with it.
For sure.
Whether it'll help you more than others, that's tough to say.
Yeah.
That goes into our next tool in terms of digestive bitters before meals. Now this will help. If you can think about it, digestive bitters are the factory startup signal to where the bitter taste receptors on the tongue send a message through the vagal nerve that fires up the whole production line from acid to the bile to the enzymes. So before the raw material even arrives. So a lot of this is just prepping the system, saying, okay, food's coming to help for that digestive system as
Warm
a
it
whole
up.
unit.
Yep.
Yeah.
Start it up.
100%. Yeah.
And bitters also help promote GLP-1 hormone signaling, which can also help promote satiety earlier. So you're not over-consuming food, which probably correlates to your stomach pain if you eat too much.
Yes.
Yeah.
Love that one. All right, Doc, I know this one speaks truth to you and hits
sure,
home a little
man.
bit.
For sure.
Stress management before eating.
This is what took away my stomach pain, managing my stress, exercising more regularly, and really just reducing the anxiety that I had with medical school and just testing and a lot of things that come with getting a doctorate. So
Yeah.
I'm sure other people have noticed stress can cause other symptoms and other issues. For me, it was gastritis, it was stomach pain. But stress management before eating, this is similar to the prep before. So we're doing breath work prior to activating the parasympathetic system, increasing the vagal tone, help get you into this rest and digest mode to obviously digest food. This would be helpful probably 30 minutes before a meal. Simple 3 to 5 deep breaths. Just get started. Try to do it, I would say 5 minutes. It really doesn't take long. And then also, while you're consuming food, put the phone away. Try to do something relaxing. Have a nice view. If you are studying, learning, doing something that requires more sympathetic tone while you're eating, I was doing it in school.
It's so cool.
It just doesn't give you a chance to get into parasympathetic mode. So just be understanding of that if you are struggling with stomach issues.
Love that.
Yeah.
And then that goes into our next one, reducing or eliminate NSAIDs. So I know we brought this up already. A lot of people are in pain. I get it. You want to get out of pain, but over time you start hearing these things. Why do we not want to take NSAIDs all the time? It can break down the stomach. It can affect the stomach lining and how you process foods, and thus leading to increased gastritis, ulcer risk, which is a whole thing in itself. Yes, you want to use NSAIDs for an acute use, but like you said, after what?
10 days.
10 days.
Yep.
See
And what's
someone.
crazy is I have a patient who now says that she only managed her pain with NSAIDs for I think 5 or 10 years, and it's her stomach lining has gotten so bad that when she does have pain and she takes an NSAID, her stomach is on fire.
Wow.
And she said it only happens now when she takes an NSAID.
Wow.
And I think it's just because she has such a reduced lining of her stomach from a chronic NSAID use, and she really tries to avoid NSAIDs, not because she's being proactive. It's because it hurts her stomach so much to use them right now.
That's insane.
Yeah.
Especially over time.
And I would hate for patients to fall into that kind of issue. Now, I'm never promoting NSAID use, but if you need it for a short period of time, yeah, it's nice to have for some people. But if you've chronically exhausted that path, now it's harder for you to manage not only your stomach, but your pain in general.
Very, very true.
Yes.
So let's go into some maybe more of a natural, maybe more experimental side of things that may help some people, but may not at the same time. I know zinc is a huge thing, or zinc carnosine is huge as well, which zinc is required for the stomach's perineal cells to produce hypochlorhydric acid, or HCl. So Zinc deficiency is one of the most common drivers in low stomach acid. A good protocol for this would be 75 to 150 milligrams of zinc daily with food. This is separate from calcium and iron itself. I know whenever I feel like I get sick or I'm starting to feel like a stomach bug, zinc is my first go-to in addition to a couple other things.
Nice.
It helps really well. I'm assuming you use zinc in all this
I've
stuff
taken
before.
zinc. Zinc carnosine is the more stomach-focused one that a lot of providers will recommend.
Cool.
The zinc carnosine can be used daily. I would say from what I've found as far as evidence, it's promising. It's not as strong if obviously you have an actual stomach disease like an ulcer, or if you need to manage your dysbiota, dyspepsia. There are probably other ways that you can go about managing it, but it does have some promising results for improving just symptoms.
Sure.
Now, if they're caused by, again, disease or issues, I wouldn't use zinc carnosine as a treatment. But it can, multiple studies have shown mucosal healing, barrier restoration when it comes to the stomach. But again, there's not a lot of side effects with it. Probably something that I would say if a patient is interested in trying, it's not a big deal.
Interesting. So that goes into the next one. Mastic gum.
I know nothing. I know nothing about it. Do you?
No, not much. From what it shows, so mastic gum is a natural saboteur remover, if we will. It pretty much directly affects the antimicrobial activity against H. pylori. This is brought back from a traditional Mediterranean remedy from the mastic tree in the Greek island of Chios. There have been multiple trials of H. pylori reduction and symptom relief in gastritis with this. Protocol is 1 gram per day, split into 2 doses away from food, but it's not necessarily a replacement for H. pylori treatment if infected.
I wonder if I had anything on mastic gum.
So yeah, this is the first I'm hearing about it, but again, there's always these natural remedies that we've known for thousands of years that stand the test of time, but certain other things come along and then we as a society gravitate towards. I don't know if it's the complete best effects for the replacement of H. pylori treatment, but again, this is something that if you've tried everything or if you want to maybe go a natural route, maybe it's something that I would look into or ask the provider before going down this route, but something interesting, unique.
Yeah, all I found was evidence was mixed, not strong enough to replace antibiotic eradication therapy.
Oh, perfect.
Obviously,
Yeah.
you're going to stick with what works. I mean,
Yes.
if I'm dealing with H. pylori and I'm about to get an ulcer, possibly now down the road for stomach cancer risk,
Yeah.
I'm going to do the triple antibiotic treatment.
Yeah.
I'm getting rid of that thing.
Yeah.
I'll deal with the effects later, make sure you get a good probiotic, whatnot. But
Afterwards, yeah.
if that, for some reason, doesn't help, then yeah, we can talk other options. But
Yeah, interesting. Now, next one, I know we brought this up in the last one, deglycerized licorice. Did I say that right?
deglycerinated.
Deglycerinated. Yep.
There you go.
Hey, there we go.
Yep.
So that helps again with the mucal protection, the lining repair. Also helps a little bit for the H. pylori treatment, especially during NSAID use or active gastritis to a certain extent.
I would say again, symptom support, not a cure.
Yes.
Can help with gastritis-like pain. Calms the stomach, soothes the stomach. Is it placebo? Who knows? But safe option for you, if you're having a kind of a flare-up of stomach pain.
Wow.
Yeah, for sure.
I love that.
For sure.
Now, this is when I've talked to many patients about in terms of fermented foods.
Yeah.
Especially if your acidity is off. Fermented foods like kefir, sauerkraut, kimchi, plain yogurt pretty much induce a diverse bacteria that helps supports the gut environment upstream of the stomach's microbiome. Even kefir has shown to help for H. pylori, so reduction. But starting small will help. Even just adding some of these into your everyday regimen or weekly or bi-weekly, monthly regimen helps for the maintenance long term.
I don't think people are eating enough fermented food.
No, I don't think so either.
I don't think they are taking a intentional approach to eating more fermented food.
Yeah.
It is super helpful, something that has been a practice for a long period of time. Unless you are seeking it out, there was never a necessity to ferment food until we changed, obviously, refrigeration and storage practices. But this was a way of life for people. They would make kimchi for thousands of years, sauerkraut for the Germans. And
Pickles
again,
get worked into that too.
there are individuals, I can't remember, I think it's Chinese, but they make fermented soybean paste.
Oh, sure.
So they'll have bricks of soybean paste. They ferment it to reduce the moisture, and then when there's not enough, when there's zero moisture, it'll never mold.
Oh, wow.
And so natto is fermented
yeah.
soybeans,
Yep.
very common delicacy. But soybean paste, I can't remember what the fermented soybean paste is called, but they'll put it over their tofu. They make it, if you've seen how it's made, it's interesting. They take these bricks and they clean them first with steel wool, because these bricks are, this legit looks like a brick.
Interesting.
It's a fermented soybean paste. And then they clean it to get all the crap off of it. Then they take this heavy knife and they chop it up because it's hard. Then they throw it into a, it's outside, by the way. It's all happening outside in the sun.
Huh, okay.
They throw water and then they mash it up with this homemade masher. And then once it's all mashed, they put a covering over it and they let the sun just bake and ferment it. And then I think it takes, I'm not sure how long it takes, but they continue to mash it. And then over time, it ferments. And then they literally go outside and they just leave it outside, take a ladle, scoop it, bring it in, put it on their tofu, and they eat it.
Interesting. Ballsy.
I'm curious what that would taste like. Super helpful, though.
My mind goes back to who the heck thought of doing that in the first place and then consuming it.
I'm sure they were like, look, all we have to grow is soybeans during a famine, maybe. Okay, how do we get these soybeans to last? Well,
good point.
if they've already made jerky, then they knew that taking moisture out of something was probably helpful. So
makes
how can we
sense.
take the moisture out of the beans? I don't know. That's my only guess.
That's a great call.
Yeah.
Great call on that one.
Yeah. All right. Next, betaine HCl. So betaine HCl, I've heard a lot of good outcomes with patients taking betaine HCl.
I've never heard of this before.
When I took betaine HCl, it did help me, but this was because of the acid conversation. And I kept thinking it was an acid issue. But there are patients who respond well to betaine HCl when having stomach issues. The theory, we'll call it, because again, we're still learning, right? It's marketed for patients with low stomach acid. So you're basically essentially taking these tablets of dried HCl, stomach acid.
Oh, good Lord.
And now, if you have an ulcer, this will make it worse, for sure. So you got to work with a provider, make sure you know what you're doing. But basically, if you are in the low acid group and you take this, you'll respond well to it.
Sure.
And I think that's who the patients that are responding to it are getting a certain change.
And is that responding well for a shorter period of time?
Yeah, I'd say so. When you truly look at a patient with gut issues, it shouldn't be, okay, you have gut issues, perfect, let's try this. It's like, okay, let's start from the top and let's really think about where in this chain could things be going wrong and all the outside things that could be affecting it.
Love that.
And I think there are times where providers think like a primary doctor. You come in, you got a problem, here's your med. You come in, you got a problem, here's your supplement.
Yeah.
Not quite the route to fix. Not to say that
physiology.
we definitely want to help you. We want to prescribe, we want to make sure you're feeling
Yes.
better. But these are just short-term, maybe subtle helpful fixes.
There's a reason why we go to medical school for a longer period of time. And yes, for us chiropractors, we don't spend an immense amount of time in this
Yes.
area, but we still spend a decent amount of time in understanding when there's a dysregulation here, what are certain things you need to check or refer out, when to refer out.
For sure.
So it's knowing the physiology, and if part of the physiology is off, can you alter and affect where the root cause is coming from to help the whole system as a whole?
That's it.
That's
really it.
And good providers can look at it from multiple scopes.
Yep.
Have multiple experience with different ways of treatments.
And hopefully work together. That's also the
Love
big thing.
that.
I want to make
Great
sure
point.
that they know that they're working
Great
together.
point. So big thing for this, red flags to be aware of. So see a provider and just don't experiment if you have burning or gnawing stomach pain that just wakes you up at night, pain that is significantly better or worse immediately after eating, black, tarry stool, blood and vomit. This is emergency. Unintentional weight loss alongside digestive symptoms, difficulty swallowing, feeling of food getting stuck, and first-degree family members with stomach cancers, obviously all those. Go see a professional sooner than
Absolutely.
later.
Yeah, absolutely. Alrighty, guys. If this was helpful, please share and subscribe. We hope you guys are enjoying this series so far. We got more coming down the road. Until next time, you guys have a good day.
Woo!
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.